Hi there again, guys. Dr. Dan Bockmann here. Welcome. Today we're going to talk about sciatica. Sciatica is that scourge of most people's existence. Whether they've had it or not, they're terrified of getting it. I'll have patients come in, they'll say, man, my back really hurts. I just hope it's not sciatica. And I think what they mean when they say that is, I knew someone who had sciatica once and it was horrible and they were disabled, they had to have surgery, and I just don't want it to be that because it seems like it's a really difficult thing to fix and it must be the result of something terrible going on inside me. When in fact that's almost, I won't say never, it's never, not, it happens occasionally that surgery is the best fix, but the huge majority of the cases that we see in my office, we fix in a very straightforward way, 2, 3, 4 visits, and it's easy to fix, it's easy to get rid of and keep your results after. So what is sciatica? Sciatica is irritation of or pressure on the sciatic nerve. The sciatic nerve runs down through your butt, one glute, your cheek there, down the back of your thigh, calf to sole of foot. It's the nerve that supplies sensation and pain in those areas. And all sciatica is pressure on that nerve somewhere. So it can be, that pressure can happen in several different places. It could happen in your spine, it could be a disc bulge or a bone spur that's pressing on that nerve. But far more often, the reason that nerve's getting pinched is not from something buried deep in your spine that's degenerative or arthritic or needing surgery. It's from tight muscles around the hip or even the hamstring. Hamstrings can lead to this too. Tight calves can lead to this as well. Anything that's applying pressure to this nerve along its path can give you the radiating pain or numbness downstream below that pinch point. So, and then by the way, with sciatica, it does not have to run to your foot. You can have sciatica, like the less pressures on that nerve. If it's a lot of pressure, it tends to radiate further. If it's relatively less pressure, it may just radiate into your glute or stay in your glute and feel like it's just glute pain and just like kind of hip pain. But the more pressure there is, typically the farther it radiates. So job one is relieving the pressure on the sciatica, on the sciatic nerve. And the typical best treatments are going to be stretching and massage. So whether it's you getting a massage or me doing it to you or you using a foam roller or a lacrosse ball to do some massage every 2 or 3 days until it becomes less painful to roll those areas, or stretches. So stretching and massage are the two biggest wins there, which is not to say there aren't other needs as well that may have contributed to that sciatica, but the main point is, again, sciatica is not scary, even though everyone will tell you it is and they're terrified of getting it. If you do have it or know someone who has, let them know not necessarily a big deal, and we'll figure out the fix right away. Yeah, I hope that's answered a couple of questions there, and if it has, great. Subscribe below for more. If you have a question of your own you'd like me to address, leave it in the comment section below, and I'd like to see you next time in here. Bye, y'all.